Hello everyone, welcome to another video. So today we are going to be talking about the most common infection affecting Nigeria currently, affecting most parts of the sub-Saharan Africa. So we're going to talk about the malaria parasite. And basically malaria is a life-threatening infectious disease, and it is caused particularly by protozoan parasites known as Plasmodium. So these protozoan parasites, they are usually transmitted by a particular vector known as the female Anopheles mosquito. So it's transmitted when this mosquito bites an individual, and up till now malaria remains a major global health problem, especially in Africa, in Asia too, in South America. And usually children under the age of 5, pregnant women, and immunocompromised adults, they are particularly the most vulnerable to this infection. So malaria has actually existed for thousands of years, and it has significantly shaped human history. So global malaria eradication efforts, they have been ongoing, yet the disease persists, mainly due to number one, drug resistance, insecticide resistance, and climate factors. So that's why there are new classes of anti-malarials that are being brought out due to the resistance, especially to ACT combinations. So the World Health Organization, that is WHO, it reports that there have been like about 200 million cases of malaria globally since 2022, with average of like up to 600,000 deaths following these cases. So looking at the causative agents, so there are 5 species of Plasmodium, and these 5 species of Plasmodium, they cause malaria in humans. So we have the deadliest and the most serious one, Plasmodium falciparum. So it causes the very severe malaria, and is actually the most common cause of malaria. So we have Plasmodium falciparum, Plasmodium vivax, which causes Plasmodium vivax is known to cause relapsing malaria. Then Plasmodium ovale, also known to cause relapsing malaria. Then we have Plasmodium malariae. Plasmodium malariae causes chronic infection. Then there is Plasmodium knowlesi, which is zoonotic and is more common in Southeast Asia. So the main vector for all these Plasmodium species is female Anopheles mosquito. So we have Falciparum vivax, ovale, malariae, and knowlesi. So looking at the anatomy and the physiology, the malaria parasite has 2 life stages: the asexual phase and the sexual phase. So in humans, it undergoes the asexual phase. So in the liver stage, the sporozoites, they infect hepatocytes, and then in the blood stage, the merozoites, they infect the red blood cells. And when these merozoites infect the red blood cells, that's when we start seeing the occasional symptoms of malaria. So in the mosquito, so this liver stage and the blood stage, it occurs in us, like the individuals. Then in the mosquito, that's when there's the sexual phase. So the gametophytes taken up during a mosquito blood meal, that is when the mosquito bites an individual. So sexual reproduction occurs in the mosquito midgut, and usually infected red blood cells can rupture and release parasites, leading to cyclical fevers. So this is what causes the fevers that we see in malaria. So For the breakdown again, first the mosquito bites, like the mosquito will bite an individual, and from this bite the mosquito will introduce sporozoites. So this will lead to the starting of the asexual phase in the human, and to release these sporozoites into the bloodstream, and then the sporozoites will evade to our liver cells. They will evade to our liver cells, they will mature, they will multiply, and this stage is usually called the pre-erythrocytic stage, because this stage is before it gets to the red blood cells. So this is the pre-erythrocytic stage, when the sporozoites that have been injected from the mosquito evades the liver cells. So after evading the liver cells, it will mature, it will multiply, and then merozoites will now be released, evading the red blood cells. That is this is known as the erythrocytic stage. So infected red blood cells, they rupture cyclically, and this leads to the symptoms like fever, chills, anemia. So all the characteristics malaria symptoms, they occur due to the rupture of these red blood cells, and then organ dysfunction can occur in severe cases. So in Plasmodium falciparum, infected red blood cells, they adhere to endothelial cells, causing something known as microvascular obstruction, leading to cerebral malaria and other severe forms. So looking at the typical signs and symptoms of this malaria, so in adults and children, for uncomplicated malaria, see fever, chills, sweating, headache, vomiting, muscle aches, fatigue. Then in severe malaria, especially Plasmodium falciparum malaria, there can be cerebral malaria, that is presence of altered consciousness, presence of seizures. Then there will be severe anemia, hypoglycemia, acute respiratory distress, renal failure, and even jaundice. So when there is malaria in pregnancy, it's also very complicated. That's why most pregnant women are advised to undergo the preventive malaria therapy in pregnancy. So in pregnancy, the complications that can occur, like severe anemia, increased risk of having miscarriage, then there could be chances of low birth weight, stillbirth, maternal births, and placenta malaria. So for the other conditions that could mimic the symptoms of malaria, there are actually a lot, like typhoid fever. That's why most people that come for malaria treatment, we often tell them they should treat for typhoid too, because the symptoms are very similar for uncomplicated malaria and typhoid. So typhoid fever, dengue fever, sepsis, viral infections like influenza, then meningitis too. So those are just the other infections that have similar signs as we see in uncomplicated malaria. Then for the diagnosis, number one, microscopy, like light microscopy, so is the gold standard. So thick and thin blood films are stained with Giemsa, and then we can also do rapid diagnostic tests that can detect the antigens for Plasmodium falciparum. Then PCR, polymerase chain reaction, is highly sensitive and is mostly used in research cases and for confirmation. Then serology too, which is not useful for acute diagnosis, and it helps to detect past exposure to this Plasmodium falciparum. So for the treatment, we have, for the treatment of adults and children, in cases where there is uncomplicated malaria caused by Plasmodium falciparum, the best treatment to use is the ACT combinations, that is artemisinin based combination therapy, like artemether lumefantrine, artesunate amodiaquine, artemisinin piperaquine. Then when there is non-falciparum malaria that is caused by other plasmodium like Plasmodium vivax and ovale that cause relapsing malaria, we could do the relapsing malaria is basically malaria that reoccurs. So we could do the ACT combinations plus primaquine to clear the liver hypnozoites, which helps to prevent the relapse. So this, most of the time, this Plasmodium vivax and ovale, they can become like how do I put it, they can become like dormant. So like dormant in this liver, in the liver. So we have to add something to help to clear the liver hypnozoites, which will help to prevent the relapse. So for severe malaria, like we can use IV artesunate, which is preferred, and followed by a full course of oral ACT combinations. So in pregnancy, we have to, when there's malaria in pregnancy, we have to be more careful in what we give. So especially during the first trimester, because that is the most complicated stage of the pregnancy. So for the first trimester of pregnancy, we give quinine plus clindamycin. We don't give ACT combinations because the safety of ACT combinations is not yet fully established, like the safety of giving ACT combinations in the first trimester of pregnancy. But we could give it in the second and the third trimester, so it's preferred in this case. So something that is very important, that is always important to check G6PD deficiency before giving primaquine when you are treating for the relapsing malaria due to the risk of hemolysis. So looking at the prevention, so we do for prevention, number one, vector control. So using insecticide treated bed nets, and indoor residual spraying of insecticides. Then chemoprophylaxis. So for travelers, they can take, like if they know they are traveling to endemic areas or just for prevention, they can be given atovaquone, proguanil, doxycycline, or mefloquine. Then for the case of pregnant women, there's something called intermittent preventive treatments, that is IPT. So pregnant women are given this combination to help to prevent malaria during their term of their pregnancy. So it's made up of a combination known as sulfadoxine, pyrimethamine, and is given at scheduled antenatal visits. Then in children, there's also like seasonal malaria chemoprevention, SMC, in endemic areas. Then there's also vaccination for malaria, which is known as Mosquirix. Is a vaccine for children, and it helps in like moderate protection against Plasmodium falciparum. So in summary, what causes malaria? Plasmodium parasites, specifically Plasmodium falciparum. How is it transmitted? Through female Anopheles mosquito bites. What are the key symptoms? Fever, chills, headache, anemia. Diagnosis: light microscopy, PCR. Treatment: most of the time we give ACTs. Then for severe cases, we give IV artesunate. And prevention, using bed nets, vaccines, and chemoprophylaxis. So thank you for watching this video. I'm sure most of you watching this video about malaria already know about almost everything that I've said in this video, because malaria is so popular that like most people already have basic knowledge about it because of how often they've treated it, and even if it's not for themselves. But I don't think there's anybody that can say they've not had malaria before, especially if you are living in Africa. So that is it for this video. Thank you.